Bismillah ar-Rahman ar-Rahim. Causes of cough. Respiratory. Causes of cough include the following: infection, such as viral upper and lower respiratory tract infections, bacterial pneumonia, tuberculosis, and pertussis, and others. Chronic bronchitis, obstructive airway disease, such as chronic obstructive pulmonary disease and bronchial asthma, cough variant asthma, eosinophilic bronchitis, obstructive sleep apnea, which is nocturnal type of cough, lung cancer, bronchiectasis, cystic fibrosis, interstitial lung disease, airway irritants such as smoking, dust, fumes, airway foreign body. The mediastinal causes of cough include the following: external compression of the trachea by enlarged lymph nodes, such as lymphoma, tuberculosis, mediastinal tumor, cystis, masses. Cardiac causes of cough include left ventricular failure, left atrial enlargement, such as severe mitral stenosis. ANT causes, air, nose, trachea causes of cough include upper airway cough syndrome, which include acute or chronic sinusitis, postnasal drip due to perineal allergic or vasomotor rhinitis. Gastrointestinal causes of cough include the gastroesophageal reflux disease, esophageal dysmotility, stricture, or pharyngeal pouch causing repeated aspirations, oesophago-bronchial fistula. Central nervous system causes of cough include neurological disease affecting swallowing, causing repeated aspiration, such as stroke, multiple sclerosis, motor neuron disease, or Parkinson's disease. Drug causes of cough include angiotensin converting enzyme inhibitor. Some inhaled preparation can cause cough, particularly ipratropium. Other causes of cough include idiopathic cause, airwax by vagal nerve stimulation, and psychogenic or habitual cough.